So we put out, and you did a News You Can Use. You did a video this week about the Department of Defense sending us some relief. So Craig would like us to comment on the news report of the military assistance. We also received some feedback. I had no idea your staffing was so dire that you had to request assistance from the Department of Defense. So can you kind of put both of those into perspective for us?
So the cavalry arrived, so to speak. They didn't gallop in on white horses or anything, but at 9 o'clock this morning, I had the pleasure of welcoming 21 U.S. military healthcare workers to Kaweah Delta. Carrie Noeski and I up on the 5th floor of our SSB building, the Graduate Medical Education Classroom. They were all masked, they were all in scrubs, they were all socially distanced, but we welcomed them to Kaweah Delta, expressed our deepest appreciation and gratitude for their arrival and their service to our country. They looked like just regular people. They were not in uniform, they were not saluting us. They looked just like any other group of new Kaweah Delta employees, you know, in their scrubs, and men and women, and just looked like nurses and doctors and respiratory therapists. So, but 21 of them. Our staffing, do I use the word dire? I don't know. It's lean. It's challenged, no doubt about it. When you have 70 of your clinical bedside workforce that are under quarantine. We have others that, again, just took leaves of absences. Plus, we're always running shorthanded. I mean, generally, at any time, we're 60 to 80 to 100 open RN positions that are posted that we're recruiting for. I mentioned that we're spending $80,000 a month right now in what we call extra shift bonuses, that if a nurse is willing to work an extra shift in the pay period, not only will we pay her time and a half, but we'll give her a $400 bonus. So bless our nurses who've been willing to do that. We're delighted to pay the bonus because it means we have a nurse that is willing to continue working and taking care of our patients in our community. But it is very thin. So perhaps that word got out because we didn't call the military. We did not call the Department of Defense. Actually, I received a call from Dr. Dave Duncan. He's an emergency medicine physician in Sacramento. He oversees the Emergency Medicine Services Agency. And so he called me on Monday and informed me that the U.S. Department of Defense was deploying 190 servicemen and women, healthcare workers, to hospitals throughout California that were experiencing significant rises in case, both the positivity rate, the number of cases, the number of deaths. And Tulare County hit the radar screen. And so they called us. They said, you've got till 5 o'clock on Monday to accept or reject this invitation. We'd like to send a team of highly trained and skilled workers. They'll be there for 1 month. They'll just become part of your team, and you can before we were kind of told, Dr. Duncan was telling me on Monday, they want to work just in the ICU. They want to come together as a team. Don't separate them. Just give them 8 patients, and they'll take care of them 24/7. Then, as we got more and more into the week, it was, no, you can use them however you want. You can split them up. You can deploy them wherever you need them. You can use them, that was beautiful.
Right.
I mean, that definitely makes it easier for us. So now to us, they're just like a nurse traveler that we would contract with, or a locum tenens physician that was filling in for a physician on vacation. They're very much like that. They're staying over at the Marriott. They're going to become part of our community for the next 30 days. We told them where all the restaurants were, and they were delighted to hear the ocean's only a couple hours away and the mountains are less than that. But yeah, so they also sent a couple to Hanford Hospital. They sent a few to Community Regional Medical Center. But I think they have 18 different missions. So we actually were a mission for them with a number and everything. And so I think they've got 18 different hospitals that they're going to deploy healthcare workers to.
And it helps relieve our staff in some of the short-staffed areas that are really struggling to meet those,
Absolutely.
you know, ratios.
Yeah, so nobody could be more excited for their arrival than our nurses
Right.
and our
Right.
physicians. So.